We all love looking at beautiful scenery, watching a great movie, or seeing our kids or grandchildren play. But we probably take our eyesight for granted at the best of times. We want to talk about properly taking care of our eyesight and how to deal with vision problems when they come up. Dr. Mansoor Choudhry, an optometrist with Vision Effects Eye Clinic, joins me now at the desk right here in Lethbridge. Welcome to Bridge City News.
Thanks for having me.
Now, doctor, how often should we really go in for an eye exam?
Now, we recommend everyone get their eyes checked at least once a year, especially diabetic patients. You know, a lot of people think that, maybe 2 years is good enough, but once a year is pretty standard. A nice comparison I like to draw is, we get our teeth checked every 6 months, we get our oil changed every 6 months or 5,000 kilometers, and I'm pretty sure everyone wouldn't want to lose their vision. So annual exams, I think, are pretty standard for most clinics across the board.
How about for kids that don't know their alphabet yet? They can't read.
Yeah.
How much of a challenge is that doing an eye exam, right?
It can be challenging at times, but we get patients as young as 6 months coming into our clinic, and we actually recommend that they should have their first exam by the time they're 1. And every doctor has their own little tricks that they have to deal with the younger patients, but we can put up pictures or shapes, but mostly at that age when they can't communicate back to us, it's mostly objective, but we can get a pretty good idea of their overall eye health from our objective testing as well.
So I'm curious, what actually impacts our eyesight and causes our eyesight to decrease? Is it a lot of it that the eye is actually changing, evolving, the eyeball?
Yeah, so I mean, if we're talking about just having nearsightedness or farsightedness or astigmatism, that's, we're pretty much born with it. Most of it's genetic. If we talk about needing reading glasses, when, we get to that certain age where we start, pulling things further away, that's more of a muscle issue. But there's not really much we can do in terms of not needing glasses. You're kind of born with the DNA that we have, and you just try to do the best way we can.
What about these glasses that you can pick up maybe at some of the retailers out there, some of the superstores out there?
Yeah.
The real cheap ones, like my mother says, I don't have to go see an optometrist, son. I just pick these ones up for $3-4 bucks and I'm good to go, right?
Yeah. So those can work pretty well for some people.
Like for reading, right?
Exactly right, just for correcting your near vision. But the problem is that most of the time your prescription in your right eye is different than your left eye and vice versa. So if you grab just a +2, but your inherent prescription is, maybe a +1 in the left eye, maybe a +250 in the right eye, it's not going to work that well in the long term. So, I wouldn't say it's a good idea to replace an eye exam per se, just because that's only covering one aspect, which is just seeing up close, where, your overall eye health is much more important, and it takes a little bit more detail than just that, but they can work for some people. But
what about cataracts? What actually causes them, and at what age do they tend to start?
So cataracts, they start in the lens of your eye. Everyone's born with a lens in their eye, and over time, they're made up of proteins, right? So over time, these proteins break down, is the best way to describe it. When that happens, that's when patients experience cloudy or foggy vision. Now, they typically start in your, late 40s, early 50s. That being said, you're not gonna notice much visual impairment for the most part. Typically when they start to bother people, it's in their early 60s or mid 60s. Everyone's a little bit different, but that's generally what we see case by case.
So what are some of the symptoms then when you think you may have cataracts?
Just an overall decrease in vision. You're putting on your glasses, people take them off, they clean them, and they feel like they're dirty still, or that something's just not quite right in terms of how clear their vision is. At any point, if you feel like your vision is decreasing at any age, we think it's a good idea to come see your local optometrist.
What about cataract surgery? How successful is it right now? And tell me about the healing process. Is it fairly quick?
Cataract surgery has been around for a long time, and it's actually a very successful treatment option. The success rates to the patients that we see have been, pretty good. Now, the entire process is pretty simple. You come in, if you're a patient of mine, take a look. If we think that the reason that you're not seeing well is because of the cataracts, not something else, then we basically just make a referral to an ophthalmologist in town, or Calgary Medicine Hat, wherever you want to go, and they'll have a consultation with the patient and they'll talk about the risks and benefits and see what the best option might be, whether it's surgery or whether just kind of wait, or it's a conversation we like to have case by case.
What about glaucoma? Can you explain to our viewers what exactly it is and what causes glaucoma?
Yeah, so glaucoma is a pretty scary word that throws around the clinic because it can lead to blindness. Now, the simplest way to define it is it's just a progressive disease of your optic nerve. Now, it's a slowly progressing disease, so it does take time to reach blindness. And in this day and age, we're lucky to live in a time where we have the modern technology and medical treatments available to hopefully stave that off. So the best treatment options we have right now focus on just lowering intraocular pressure or your eye pressure, and that's either done by eye drops, or what's becoming increasingly popular as a first-line treatment is surgical intervention. So those are, we're seeing a lot more patients opting for that, because what they need to understand is if you're doing eye drops, it's not for 3 or 4 months, it's for the rest of your life, right? So, but, if you just have your eyes checked regularly, we can hopefully catch it before you notice any visual changes at all.
So glaucoma and cataracts, are a lot of those attributed to maybe being hereditary, inheriting them from family members?
Yeah, absolutely. So glaucoma, we're not really too sure what causes it exactly. Again, we ask all of our patients their family history. Did your aunt have it? Your mom, your dad, your brother, your sister? And if any of those patients say yes, one of our family members do have it, we flag them right away. So not sure what exactly causes those things, but everyone has an equal chance of getting them.
Okay, let's read the fine print now on contracts.
Okay.
And sometimes people have to hold it out like, yeah, I can read it all the way out here, it's no problem. Should people still consider getting bifocals or even trifocals?
Yeah, so if you're having trouble seeing up close, everyone's a little bit different. So we like to have a chat with the patient and see what their individual needs are. If you're lucky enough to be nearsighted where you can't see far away, but you can up close, you can take your glasses off and sometimes you can see up close. If you bring the paper closer, well, you'll notice, and you're not nearsighted, you'll notice that just makes it harder. So bifocals and progressive lenses, they're very similar in the way that when you look straight ahead, you can see clearly. When you look down below the line or on the lower part of the lens in a progressive lens, the close-up vision will be clear. The problem with just reading glasses is, well, you can see great up close, but when you look straight ahead, things will be blurry. So it kind of depends on what the patient's needs are. If they know they're just going to be reading for a while, sometimes readers are better. If they're in a situation where they need to be seeing up close and far away simultaneously, well then maybe a bifocal or progressive lens might be better.
Millions of Canadians wear contact lenses, right?
Right.
They're practical, they look great as well, especially when you're on camera and so forth.
Yeah.
You don't get the reflection of the lights you do with glasses. But sometimes infections can occur or you get really dry eyes. So how can you prevent a lot of that when you wear contacts?
So most of the cases that we see in our clinics that are, bad contact lens cases we see honestly come from just the misuse of them. Now, I'll explain that a little bit further. If you're wearing a lens that you're supposed to replace every month, but you're replacing it every...
Disposables, right?
Right, exactly.
But you want to stretch it out?
Exactly. You don't want to do that. If you're wearing a monthly lens on month 6 and 7 and you're wondering why your eyes are getting red, that could be a cue. I like to use the analogy of, if you buy 10 gallons of milk and it expires, are you going to just keep drinking it because you have it? Probably not, right? You're going to listen to what the manufacturer recommends. So, but, dryness is a huge issue in Southern Alberta, Lethbridge especially when we get our, strong winds happening.
Oh, yeah.
So if you're one of those patients that struggles with that, sometimes just changing into a better modality like a daily lens or just having an adjunct treatment like eye drops or other things to combat the dry eye first at the root of the cause, and that can help with contact lens wear as well.
Can contact lenses actually reverse nearsightedness when it comes to children?
Right, so now we just started getting these lenses into our clinic recently. Now, if you're a child that is nearsighted, generally what happens is that just progresses slowly over time. You might be a -1 one year, next year you're -2, 3, 4 on, and all of a sudden you end up like me, who I was a -8 at one point, right? So
Okay.
now we do have lenses available now that have been proven to either slow down that progression or stop it completely. So that's something cool and exciting that's in optometry today.
How do you help people though, doctor, when it comes to putting on contact lenses for the very first time? I mean, you get anywhere near my eyes and I freak out.
Yeah.
I can't and I see my wife, she pops it in. I'm
no
like,
problem.
how do you do that, right?
Right, so if you're interested in contact lenses and you've never worn them before, you can come into our clinic and we set you up with a contact lens fitting, we call it, with one of our fitters. And they just spend a lot of time with you teaching you how to put them in, take them out, that kind of thing. And, you can tell pretty quickly if you're able to do it or not. And if you can't, that's okay. You can, keep trying, or if you do it, great. It's one of those things that does take some practice, but, you do it enough and like with anything, it just gets easier and easier.
That's right. How about the multifocal contact lenses? How effective are they compared to glasses? Or are glasses still the better route to go?
We've actually had quite a bit of success with multifocal lenses in our clinic. That number seems to be increasing, every year that goes by. And I think the reason for that is, we get our contact lens wearers that have been wearing them for several years or decades, and they get into that, age range where they need a little bit of help up close, but they don't want to give up their contact lenses. Now, a lot of people don't know that just like bifocal or progressive glasses, well, there's bifocal and progressive contact lenses as well. And depending on your prescription and just your experience with contact lenses as well, and a little bit of patience, it can become pretty successful pretty easily. So, I mean, glasses, the vision you get from glasses is hard to replace depending on your prescription. If you have a pretty complicated one, we can still give you contact lenses to help you see pretty good. It might not be as great as your glasses, but we can get pretty close.
What about floaters? Can you explain to our viewers what exactly causes floaters and how do you get rid of them?
Yeah, so floaters, they're a very common issue as well. Now, the back of your eye, there's a thick gel-like fluid known as your vitreous. And, quite simply, some of it starts to break down, and those pieces that break down can clump together, and that's what causes those floaters. It's kind of why if you kind of move your eyes and you look left to right, it's kind of like shaking a snow globe, except with a few snowflakes instead of hundreds, and you can see them kind of float around. Now, generally, they're pretty harmless. It's nothing to be too concerned about. But if you ever notice that there's significantly more and, something's just not right, it's the best thing to do just to come in for an exam. In terms of getting rid of them,
Yeah, can you flush them out?
there's
Like,
not
can you
really
do
much.
anything?
Yeah, it's an ongoing question we get all the time.
Or exercises maybe for your eyeballs, right? Massage them? I don't know. What do you
There's
do?
not really much we can do right now. Now, there's been some talk of some laser therapies that might, help get rid of them. But at this point, since they're not really too harmful, the risk of, operating in the back of your eye just isn't worth, something that's just a little bit annoying.
How about laser eye surgery? I remember when it first came out when I was younger, how
Yeah.
expensive it was.
Yeah.
It's like $10,000 an eye, like 20 grand. I'm like, wow, who
Yeah.
can afford to do this? But it's come down substantially now. I mean, you can get an eye done for under $2,000 an eye now. So how effective is laser eye surgery? And what are some of the dangers, I guess?
It's been pretty successful. I'm actually one of the few optometrists that has had it done themselves. So
okay.
I had it done about 5 years ago. Again, I was really nearsighted. Thought, I'd see if I was a candidate. I went through the process, and, I can see perfectly fine to this day. We refer a lot of patients to get the surgery done, and we follow up with them after for many years after. And honestly, for the most part, it's pretty safe. A lot of the fears we get from patients are, am I going to go blind? Am I going to lose any vision? And honestly, there's a very, very small chance that you'll go blind, if any. But the other fear is, well, what if my vision starts to regress? Now, again, everyone's a little bit different. Everyone reacts to medical treatment differently. But, there are clinics out there that offer lifetime warranties depending on what procedure that you get, because there are different laser corrective options available, right?
Do they actually freeze some of the eyeball and then shave the cornea? Take that off, create like a...
Right, so how
Your own
LASIK
contact
works
lens?
is they'll
Yeah.
numb your eye just with eye drops. There's no
Okay.
needles or anything. There's no one
Right.
in your face. It's not
Right.
very invasive, I thought anyways. They basically just make a cut on your cornea, lift the flap, laser it to reshape it, put the flap back, and then when it heals, you can see. But when you have laser or LASIK done, you can see that very day. So you stand up
Wow.
and you can see significantly better than
So the
without
healing
correction.
process is quite quick then.
It's pretty quick, yeah. To be fully healed, it's a few months, but in terms of how long will it be till I can see again, it's that very same day you can see.
Well, what about the eyeballs changing shape, though? That's what some people say. Forget about it. It's cheaper to go with contact lenses or with glasses because your eyeballs are going to be changing shape anyway. You'll have to have more laser eye surgery done.
So
right?
if you're thinking about getting LASIK done, again, it's case by case. We like to evaluate, well, have you been getting regular eye exams? Do we have a good enough portfolio of what your prescriptions were? If it's still changing significantly, I wouldn't recommend you to get it done. Another thing, well, if you're a woman and you're not quite sure if you're done having children yet, well, you might want to wait as well, because after every pregnancy, your vision can change again. So with my patients, good candidates, their eye health is in good standing, their prescriptions have been pretty consistent over the last few years, and they're not planning to have children if you're a woman in the next near future, because again, it can change as well.
Who are some other candidates who should really seriously consider not getting laser eye surgery?
Generally, everyone's it's case by case, but for the most part, if you have any substantial healing problems, if you have an autoimmune disease, sometimes they'll be ruled out. If you're
How about diabetes? Would that
diabetes,
play a role?
we're careful with those patients because, again, if your sugar levels are up and down, well, that can by default change your prescription as well. So if you're diabetic, you can be, prescription A, and after a few months be prescription B if it's not controlled. So it's, again, case by case, but for the most part, it's safer for most people, and there aren't too many people that get the answer no when they get the consultation done from the surgeon. At the end of the day, it's their call, but it's becoming more and more popular.
How about night blindness? How often do you come across that?
From the laser surgery?
Yeah.
It's becoming decreasingly prevalent. It used to be a big problem, I think, when it first came out. And, like I said, nowadays it's still common for me personally. I had it a little bit for the first few weeks, maybe the first month, but every week as you're healing and you're completely healed, it's not an issue for me anymore. But that being said, before you get laser surgery done or cataract surgery done, especially if you're from Southern Alberta, you should see if you suffer from dry eyes. Now, a lot of people, when you ask them, they'll say, no, I'm fine. But then you go into a clinic and you get your tear film evaluated and, well, lo and behold, you have dry eyes. I would say there's a vast majority of people in our community here, especially that have it, that may just not know because we're used to it, right? You know,
Last question I want to ask you. Colored contacts.
Yeah.
Do people still go that route?
they have decreased in popularity a lot, but,
Oh.
but we still have quite a few patients that are interested in them. So, you know, the lens companies, I think they're kind of focusing their research and design more on dailies or comfort and breathability and not so much on color anymore, but we still do have them.
Dr. Mansoor Choudhry, optometrist with Vision Effects Eye Clinic here in Lethbridge. Thanks a lot for joining me in studio today.
Thanks for having me.
On behalf of all of us here at Bridge City News, I'm Hal Roberts. God bless. Have a great night.